Yeah.
Hey guys, I hope you had a great weekend. I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're talking about pain under the kneecap. This is really common. It's not really prone to more age group than another, but it does happen a lot. A lot of times you'll report this pain going down the steps, going from sit to stand. It really can be uncomfortable. It can cause you to compensate, it can cause hip pain, it can cause foot pain. So it's really important to pay attention exactly where this is coming from and how to fix it. So one of the things that we're going to talk about tonight is the kneecap and how it moves. So your kneecap moves up and down. Now obviously it doesn't move up and down that much, but it moves up and down as you bend and you straighten your leg. Your kneecap's going to go in and out. So what happens is as your kneecap moves, one of the things that can cause that pain underneath is it's not tracking correctly. So your kneecap may be going this way or your kneecap may be going that way. And that's a result of weakness or tightness or actually more of a combination of both. So if that kneecap isn't tracking correctly, it can actually, the back of it can grind on some of those bones if it's not sitting where it's supposed to. It sits in this nice little cup underneath right underneath. And if it goes outside and it tracks wrong, it's going to come out of that cup and you're going to feel a lot of pain as the back of that kneecap grinds on that bone. And depending on how much cartilage you have behind the kneecap, it can be very painful because it can be bone on bone. As we age, we lose that cartilage behind the kneecap. So it's very common for that to be bone on bone scraping together. If you have tightness in your IT band or weakness or a combination of both and that tracking is off, that's going to cause that grinding underneath that patella. What else is going to cause that is sometimes just more of a weakness. If you go and you walk down the steps and your knee is going like this, now again, that's a really gross exaggeration, but if your knee is collapsing inward or maybe it's collapsing outward due to the position of your bones or your muscles or your weakness or your strength, if it's winding up collapsing, you're going to put pressure on that kneecap. And that kneecap is going to then, you're going to feel pain underneath there. Another cause of pain under the kneecap can be flat foot. So if you have a flat foot, and I do, I don't even actually need to over-exaggerate, but I will for the point of video, this is going to roll in. And again, this is going to be affected. You're going to wind up not having this aligned correctly. Anytime this is not aligned correctly, you're going to put pressure underneath that kneecap. That's going to cause pain with bending, with sitting, with squatting. Now, before I continue, I want to let you know that pain associated with clicking is concerning. If you just have clicking and no pain, that's nothing to be concerned about. I have Rice Krispies in my knees and in my shoulders. It sounds like the 4th of July when I bend my knees or when I lift overhead. That's perfectly fine. I have no pain when I do it. So you really need to pay attention to the fact that you can have clicking that has no pain. Now, if every time it clicks, there's some pain associated with it, that could be that kneecap actually going back into that little cup that it's supposed to sit in and going over that bone. So you want to pay attention to that type of clicking. But one of the most common symptoms I hear with pain behind the kneecap is clicking. Always understand, clicking without pain is okay, clicking with pain is not okay. Another thing that can cause pain behind the kneecap is what we call jumper's knee. And jumper's knee is just a tendonitis of the tendon up front here. Again, meaning there's weaknesses and tightnesses throughout the leg that are causing it, but as this is getting tighter and this is getting inflamed, it can push on the kneecap. It also can cause you to compensate using your leg to move in and out, which can position that knee incorrectly and cause it to have pain. But what you do need to recognize is that pain behind the kneecap is not related to the kneecap. So I've been, unfortunately, I have seen, some poor physical therapy where people are just doing this with kneecap pain. You're actually not really doing anything. You've got to find where the weakness is. It's generally not in your quadriceps. It's generally not right at the knee. You need to look above and below the knee in order to figure out where that weakness and where that tightness is coming from. It's usually a little bit of both when you're talking about the kneecap. There are no kneecap replacements that will happen. You're going to get a total joint. So if you're just dealing with that kneecap pain, chances are you're not going to have anything replaced. So you really want to find the source of the problem and not just say, oh, well, my cartilage is gone behind the knee, so I should have pain. That's not really the case. If your cartilage is gone, you should be able to still track that patella, which is your kneecap, in and out of that cup very smoothly. Maybe it's just a little rough spot, which is where you may get clicking but no pain. But you shouldn't have a ton of pain even if you don't have cartilage. So it is important to figure out, is it coming from your foot? Is it coming from your hip? And noticing those things. Do you compensate? When you walk down the steps, does your knee go in? When you go to sit down, are you sitting down and your knees coming together like that? It's a very easy, simple thing to test. All you gotta do is watch your knees as you sit down. Is something happening when you're doing that? Is this type of motion is what's going to cause that pain behind the kneecap. So really be careful of that. Now, if you're naturally bow-legged, that's a whole other issue. That's a whole other structural issue that also can cause pain behind the kneecap, but that's a little bit different than what we're talking about tonight. So you want to find the weakness. You want to find where the tightness is. I always start with the IT band, and you can look on our YouTube channel, Total Performance Physical Therapy. We have several videos on how to roll out the IT band, foam rolling the IT band. Really important in treating this. You also want to do some strengthening. So some of the strengthening that you can do is just a single leg balance, holding yourself here. If this is easy, you can go ahead and close your eyes to make it a little bit more challenging. Those are two things, that foam rolling and that balance, that you can do to really help yourself, help that kneecap get into a little bit better place. The next exercise you can do is more of a hip exercise. We call them hip hikes. All you're going to do is keep that leg straight and then just hike your hip up nice and slow and lower it easily. Again, that's going to help stabilize from the top down. You can also look into getting orthotics. Kneecap pain is not something that's as simple as just saying, okay, do this exercise and it's going to be healed. Figure out where it's coming from. It's coming from somewhere else. Why is that kneecap being pulled on? Why is there pressure enough that's going to affect that kneecap? If you or someone you know is suffering from knee pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good night.